The coronavirus pandemic is taking its toll on the world, causing deaths, illnesses, and economic devastation. Bereavement, isolation, loss of income, and also fear are triggering the mental health conditions, especially of those who are left to deal with all of these different scenarios playing out and unfolding around them. Many people have been facing increased levels of alcohol and drug use, insomnia, and anxiety. There are also concerns for people with pre-existing mental, neurological, or substance abuse disorders that are more vulnerable to COVID-19 infection, as they may stand a higher risk of severe outcomes and even death. To help us understand the psychological impact of the pandemic, we're joined by Professor Mark Blagrove from the Department of Psychology at Swansea University. Good evening, and thank you so much for your time, Professor Blagrove, tonight. You know, when one just looks at what it is that societies have been through, the entire world has been through, and people have literally just had to cope with it, right? And almost deal with the card that life has given them under these circumstances. How do we begin to take a step back and realize what the emotional and mental impact of this year has been?
Yes, it's been a very important year, Kathy, because although there have been inequalities and disparities between people and different levels of coping that individuals have got, this pandemic has made all of those things even more apparent and made the inequalities and the fact that some people can cope and some people can't much more apparent. Yes.
And when we talk about the negative effects of this disease, what are we really referencing here?
Well, our work at Swansea has been on a particular aspect of that, which is that very soon after the pandemic started, whereas we knew that there were negative effects on people becoming more stressed, people being in, say, at home where they may be forced to be with people that they don't want to be, there may be more domestic violence as a result. All these problems may be resulting. And what we looked at was what happens when they go to sleep, that their sleep may become worse, but in some instances they may get more sleep than normal. And so what we started to look at was people's dreams. So it was the idea that if people have stress when they're awake, the stress may even come over into their dreams. And various research groups around the world started to look at this. And what they were finding was that the dreams were more negative than dreams that were collected before the pandemic. And this would either be that you could get reports of dreams from people and compare them to what you expect from dreams over recent decades, or in a recent paper from Brazil, where they had looked at people's dreams, found that there was greater levels of anger and sadness, even references to contamination in the dreams, than for people collected just before the pandemic. So it is such a worry to us, it's even coming over into our dreams as well.
Much of what happened with COVID-19 was unexpected. And, you know, it's fascinating to me that you guys are looking into the issue of dreams. Are you able to tell the point at which people started experiencing these different patterns in terms of their dream cycles, if that's even the way to phrase it?
No, that's a very good question. And that's a very good point about the fact that how does somebody suddenly study this type of thing when the whole thing is very, very new? And the whole thing about this actually occurred previously in 9/11. People wanted to study the dreams of people just after 9/11. And yet they had to try and make sure there was some type of dream to compare it to,
Mm.
which of course you can't have scientifically unless you're very, very lucky. Some people were very, very lucky. They'd already started collecting dreams before that happened, just by chance. And so what some people around the world have done is to collect dream reports and to say, right, how do these differ from normal? And that's where we get these results of anger and sadness. And what they've also worked out is how much were people suffering from the pandemic? And they found out that the anger and sadness in the dreams was greater in the people who had more mental suffering due to their isolation.
You've mentioned the words there, dream reports. What kind of questions would one need to answer in a dream report? It's fascinating, this area, so, and completely new to me. So what kind of questions would one be asked in order to compile this dream report?
That's a very good question. That's another very good question, because one of the early studies, what they did was they asked people, have you had any COVID dreams or dreams of the lockdown? Now, the problem is that does get all your dreams reports which are related to that. So people were having dreams of bugs, because bugs, meaning a bug which is a little animal, is a sort of another way of talking about the bug that was inside people. So that was a way of getting reports, but in a way biased it towards those types of dreams. Now, what the recent study in Brazil has done was that they collected all the dream reports over the early part of lockdown in Brazil, which was March and April, from people, and they collected all their dreams. And that's extremely important, because you don't want people sifting through their dreams to give the most interesting ones to the researchers. And what they found was, if you collected every single one of them, and this was very early on in the lockdown, then already you were getting these anger and sadness and contamination dreams occurring then. So possibly it carried on throughout, but it's interesting that they've got them from early on. It really hit people and affected the way that they were dreaming.
Has it been difficult to actually study the pattern of dreams during this pandemic? Because you're talking about a lot of emotions, and if one just goes with, just personal experience, it can be quite a roller coaster, depending also on the kind of information that is coming through in terms of our own fight against COVID-19 and how it affects families. As the closer it comes to home, the more the anxiety grows.
Yes, that's very true about how do you actually contact people. Now, throughout the pandemic, what's happened to a lot of people is much more work being done on the internet and much more work being done by Zoom and Skype. And so what many researchers have done is to devise questionnaires which can then be sent as a link to the questionnaire, and people complete it at home. But you're correct that is a worry if people are in emotionally difficult circumstances, because if people are reporting quite negative dreams, that can be distressing for them to do that. And of course, the researchers are left in the position that it's then difficult to contact these people who are at home, who are being good enough to report, yes, I'm getting more nightmares. That is an issue there, but it is something we need to find out about, that if people's stress during the day is such that it affects their waking mental life, could even affect their sleep. If it's also affecting their dreams as well, the dreams often live on. We've found out that these dreams are often longer, if you measure them in words, than the dreams from before the pandemic. And so it's important to study them, because these can then be having an added effect on people's mental health if they're having distressing dreams.
And just provide that link for me then between the dreams that people are having and their mental health. So is there a connection there, that if I'm consistently having bad dreams, does it automatically mean that perhaps I'm not paying attention to some of the issues that might be bothering me, and my mental health might be a bit out of balance?
Yes, that was certainly found by the Brazilian team, which was that the ones who were in a worse position mental health wise were having the more distressing dreams. Now, we can't then be sure about exactly how the causality is working. Is it the mental health is causing the dreams to become like that? Or possibly the dreams themselves can be having an effect on people? Or unfortunately, some people may be particularly sensitive to their environment. And so therefore, they're not only having poor mental health as a result of it, they are the people where it also shows up in their dreams. So those are things to be disentangled later on, about this relationship between emotionally negative dreams and people's poor mental health.
Now, the idea of having people then come in and interpret one's dream, that of course sometimes is quite subjective depending on who you're speaking to. So people, should people be trying to seek interpretations of these dreams and really be sure if in fact they're going to be losing a loved one over the next couple of weeks, if those are the kind of dreams that one is having? Or must it just be taken as part of the period that we're in? So how should people be dealing then with this issue?
Right. One thing that can be done with the dreams is to tell them to other people. Because if the dream is resulting from our waking life, then telling the dream to other people can be quite helpful, not only in just expressing, I've had this awful experience or a good experience while I'm asleep, but also because it's a way of talking about yourself and revealing yourself to other people. So the first thing to be said about the dreams is that they are a way of us expressing ourselves to other people. So they can be quite useful in that regard. On the point of interpretation, Sigmund Freud was very famous for that. But of course, his view, which many modern researchers agree with, is that to interpret a dream, you have to ask people, where does that particular part of the dream come from in your life? So, for example, we had a woman who dreamt about a robin, a bird, being inside her, pecking away at the COVID. She didn't actually have COVID, but she had a dream about COVID being pecked away by a friendly bird inside. And when she thinks about the bird, that was the type of bird she would see when she was out in nature, out in a health-giving environment, getting away from things. And so you can sometimes think about, well, where did that part of the dream come from? That's a modern way of thinking about what interpretation means is, why would I have put a robin in this dream of COVID? And for that woman, it was because the robin symbolizes the health-giving part of nature. So interpretation is to do with working out, why did I use that particular image in the dream?
Professor Mark Blagrove from Swansea University, let me thank you so much for your time tonight. Absolutely fascinating work that you and your colleagues are doing, looking at the different types of dreams that people have been having and how COVID-19 has been affecting our dream cycles. So thank you so much for coming onto the show tonight.